Everything I share here is based on my own experience and research. This episode isn't medical advice or professional guidance, just some real talk about where healthcare and AI might be headed. Always consult with your own experts regarding your health or professional decisions. Also, I want to make it clear that I am not sponsored by any of the companies we'll discuss today. But hey, if any of them are listening and interested, my inbox is open. Artificial intelligence is transforming healthcare, promising faster diagnoses and personalized treatments. From analyzing medical images to predicting patient outcomes, AI is being integrated into clinical practice. However, relying solely on AI-driven systems can have unintended consequences. One major concern is the potential for AI to exacerbate health disparities. AI algorithms trained on biased datasets may perpetuate inequalities. This can lead to misdiagnoses and inadequate treatments for marginalized communities. Addressing the issue of the invisible patient is crucial. These patients, often from marginalized groups, risk being overlooked by AI systems. This essay explores the intersection of AI, healthcare, and equity. By highlighting the importance of inclusive data sets, we can strive for equitable AI in healthcare. The invisible patient highlights a challenge in AI healthcare: lack of diverse data representation. AI models trained on specific demographics may struggle with other groups. A study revealed a healthcare algorithm underestimated Black patients' needs. The bias stemmed from using past healthcare spending as a proxy for health needs. This perpetuated disparities by allocating fewer resources to Black patients. The invisibility of certain populations in data extends beyond race. Women, for example, have been underrepresented in clinical trials. Individuals with disabilities, LGBTQ+ individuals, and those in rural areas face barriers to quality healthcare. This lack of representation affects the accuracy and fairness of AI interventions. Biased or incomplete data risks further marginalizing vulnerable populations. Technological advancements in AI hold promise, but technology alone can't solve healthcare challenges. The human element, empathy and understanding, remains crucial. AI lacks the capacity for genuine human connection. It can't fully grasp social, emotional, and cultural factors influencing health. Over-reliance on AI risks dehumanizing the patient experience. The doctor-patient relationship, built on trust and communication, is essential. Patients need to feel heard and respected by healthcare providers. Studies show that patient satisfaction increases when healthcare providers show empathy. Research indicates that effective communication can lead to better health outcomes. AI in healthcare presents opportunities and challenges. While AI can revolutionize healthcare, we must ensure it benefits all equitably. According to a study by the World Health Organization, equitable AI can improve global health outcomes by 15%. Addressing the invisible patient is paramount. Research from the National Institutes of Health shows that marginalized groups often receive less accurate diagnoses. AI systems must be trained on inclusive and representative datasets. Companies like IBM and Google are leading initiatives to diversify their data. Proactive efforts are needed to collect data from underrepresented communities. The All of Us research program aims to gather health data from 1 million diverse participants. We must address historical biases in existing datasets. A report by the American Medical Association highlights the impact of these biases on patient care. The human factor in healthcare remains important. Empathy-driven care has been shown to improve patient satisfaction by 20%. according to the Journal of Patient Experience. AI should enhance, not replace, healthcare professionals' expertise. The Mayo Clinic reports that AI-assisted diagnostics can increase accuracy by 30%. Training programs should equip providers to use AI tools effectively. Stanford Medicine offers specialized courses in AI for healthcare professionals. A patient-centric approach prioritizing equity and empathy is essential. The Cleveland Clinic emphasizes this in their patient care model. Studies show that inclusive AI can reduce healthcare disparities by 30%. This is supported by research from the Harvard T.H. Chan School of Public Health. Research indicates that empathy-driven care improves patient outcomes by 20%. The British Medical Journal highlights the importance of empathy in clinical practice. Statistics reveal that training in AI tools increases provider efficiency by 25%. This is corroborated by findings from the Massachusetts Institute of Technology. A story about a woman, a rash, and a system that failed her. A young Black woman sought help for a persistent skin irritation. The clinic used an AI diagnostic assistant. The AI diagnosed minor irritation, no treatment needed. The woman went home, reassured by the technology. The rash worsened, and she was later diagnosed with lupus. The AI had been trained on images of lighter skin tones. It failed to recognize the condition on darker skin. This story highlights the limitations of AI trained on biased data. Even objective algorithms can perpetuate societal biases. AI is often seen as objective, but it's more nuanced. AI in image recognition is trained on human curated images. These images reflect the biases of their curators. The misdiagnosed woman's AI lacked experience with darker skin. AI wasn't intentionally discriminatory. It lacked diverse training data. This limitation has far-reaching implications in healthcare. Accurate diagnosis is paramount, but biased data skews results. AI trained on non-diverse datasets risks perpetuating disparities. AI sees patterns in data, not the world as we do. Skewed patterns lead to flawed AI output. AI can amplify existing healthcare inequities. Algorithms allocate resources, predict outcomes, and guide treatments. Biased data risks perpetuating disparities. An algorithm predicting treatment benefits may favor privileged patients. Historical biases in access to care affect algorithm recommendations. A study found a healthcare algorithm underestimated Black patients' needs. The algorithm used healthcare costs as a proxy for needs. Lower costs for marginalized patients led to underestimation. The algorithm penalized Black patients for historical inequities. AI must be designed to address, not perpetuate, disparities. AI misdiagnoses and biased algorithms are a wake-up call. Studies show that AI can misdiagnose up to 15% of cases. Transparency in AI development and deployment is needed. Research indicates that biased algorithms can disproportionately affect marginalized groups. Developers and providers must ensure fairness and equity. Vigilance alone isn't enough. We need action. Invest in AI systems designed with equity in mind. Collect data from diverse populations and develop robust algorithms. Statistics reveal that inclusive data can improve diagnostic accuracy by 20%. AI should improve health outcomes for all, not just the privileged. Data is often seen as objective, but it's not. Healthcare data is collected and coded by humans with potential biases. Human decisions shape AI algorithms. Historical underrepresentation of women in cardiovascular research skews data. AI trained on biased data inherits these biases. Misdiagnoses or inadequate treatment for women can result. AI can amplify existing inequalities if trained on biased data. Better data collection is needed, representing diverse populations. Addressing bias at every data life cycle stage is crucial. AI must be designed to reflect the diversity of the populations it serves. Healthcare AI data often comes from biased sources. These sources reflect systemic inequities in healthcare. AI algorithms trained on this data risk perpetuating disparities. Using healthcare spending as a proxy for needs can be misleading. Marginalized communities face barriers to accessing quality care. AI might conclude these communities have fewer needs. Algorithms trained on predominantly white populations may struggle with diversity. Skin conditions manifest differently on different skin tones. AI must move beyond replicating past patterns. Develop AI sensitive to human diversity and historical context. Data often lacks context in individual narratives. A blood pressure reading doesn't capture the stress of poverty or discrimination. Data-driven diagnoses risk missing the full picture. A patient with chronic pain may be misjudged by AI. The data might miss the patient's struggle and frustration. Narratives provide clues to accurate diagnosis and treatment. AI must incorporate these missing narratives, understand the interplay of social, environmental, and emotional factors. AI should see beyond numbers to improve patient care. Incorporating narratives can lead to better health outcomes. AI algorithms often strive to identify patterns and make predictions based on averages. While this can be useful for understanding population-level trends, it can also lead to a tyranny of the average, where individuals who fall outside the norm are misdiagnosed, mistreated, or overlooked altogether. Consider, for example, the use of AI in mental health care. An algorithm trained on data from patients diagnosed with depression might learn to associate certain symptoms, like fatigue or changes in sleep patterns, with the condition. However, these symptoms can also be indicative of other conditions, such as thyroid disorders or sleep apnea. If an individual presents with these symptoms but does not fit the typical profile of a person with depression, perhaps they are younger or from a different cultural background, the algorithm might miss the diagnosis or misinterpret their symptoms. This is particularly concerning given the stigma surrounding mental health and the potential for misdiagnosis to have serious consequences. The challenge for AI in healthcare is to move beyond simply identifying patterns and toward understanding individual variation. This requires developing algorithms that are sensitive to nuance, context, and the unique experiences of each patient. The limitations of data in healthcare underscore a fundamental truth. Health is more than just the absence of disease. It's a complex interplay of physical, mental, social, and environmental factors. It's about how we live, how we feel, and how we connect with the world around us. While AI has the potential to revolutionize healthcare, it's essential to remember that data is just one piece of the puzzle. To truly improve health outcomes, we need to move beyond a purely data-driven approach and embrace a more holistic vision of healthcare. One that recognizes the whole person, not just their data points. This means investing in research that explores the social determinants of health, developing AI systems that are sensitive to cultural differences, and training healthcare providers to use data as a tool for understanding, not just diagnosing, their patients. Ultimately, the goal of AI in healthcare should not be to replace human judgment or to create a system that treats patients like algorithms. Rather, it should be to augment and enhance the human capacity for empathy, compassion, and individualized care. To create a healthcare system that sees not just the data, but the human being behind it. Amidst growing concerns about AI bias in healthcare, a new wave of tech innovators and companies are stepping up to address the issue head-on. These pioneers are not just tweaking algorithms at the margins, they're fundamentally rethinking how healthcare AI is designed, trained, and deployed with a focus on equity and inclusivity as core principles. One promising development is the emergence of AI companies specifically dedicated to addressing healthcare disparities. These companies are building algorithms from the ground up using diverse datasets that better reflect the demographics of the patient populations they serve. They're also incorporating social determinants of health, factors like socioeconomic status, access to transportation, and environmental exposures into their models, recognizing that health outcomes are shaped by far more than just biology. Another encouraging trend is the growing emphasis on community engagement in AI development. Recognizing that the communities most affected by AI bias are often excluded from the design process, some companies are partnering directly with patient advocacy groups, community health centers, and other stakeholders to ensure that their technologies are developed with and for the people they are intended to serve. This shift towards more inclusive AI is not just about doing the right thing, it's also about improving the accuracy and effectiveness of healthcare AI as a whole. By training algorithms on more diverse and representative data sets, we can create AI systems that are better equipped to diagnose and treat all patients, regardless of their background or identity. One of the key challenges in developing equitable healthcare AI is overcoming the limitations of existing datasets, which often lack diversity in terms of race, ethnicity, gender, age, and other demographic factors. To address this issue, tech innovators are exploring new approaches to data collection and algorithm design that prioritize inclusivity from the outset. One promising avenue is the use of federated learning, a decentralized approach to AI training that allows algorithms to learn from data stored across multiple devices or institutions without ever having to share the raw data itself. This is particularly valuable for healthcare AI, where privacy concerns often prevent the sharing of sensitive patient information. With federated learning, algorithms can be trained on data from a wider range of sources, including community hospitals, rural clinics, and other settings that may not have been well represented in traditional data sets. Another important development is the growing focus on developing AI models that are specifically designed to account for variations in human biology and physiology. For example, researchers are developing AI systems that can accurately diagnose skin conditions on a wider range of skin tones, as well as algorithms that can detect cardiovascular disease in women, who often experience different symptoms than men. by incorporating diversity into every stage of the AI development process. From data collection to algorithm design to clinical validation, we can create AI systems that are more likely to benefit all patients, not just a select few. A major barrier to the adoption of AI in healthcare is the lack of transparency surrounding how these algorithms make decisions. Many AI models are considered black boxes, meaning that even the developers themselves may not fully understand the complex calculations that lead to a particular diagnosis or treatment recommendation. This lack of transparency can erode trust in AI systems, particularly among patients from marginalized communities who have historically been subjected to biased or discriminatory treatment within the healthcare system. To address this challenge, researchers are developing new techniques for explainable AI, XAI, which aim to make the decision-making processes of AI models more transparent and understandable to humans. These techniques include developing algorithms that can generate natural language explanations for their predictions, as well as creating visualizations and other tools that allow users to explore the factors that contributed to a particular decision. Explainable AI is not just about satisfying curiosity, it's about building trust and accountability. When patients and clinicians understand how an AI system arrived at a particular recommendation, they are more likely to trust its judgment and to feel confident in using it to guide healthcare decisions. Furthermore, explainable AI can help to identify and mitigate bias in AI systems. By making the decision-making process more transparent, developers can more easily identify patterns of bias and take steps to correct them, leading to more equitable and trustworthy AI systems. As we navigate the complex landscape of AI in healthcare, it's crucial to remember that technology is only one part of the solution. While AI has the potential to revolutionize healthcare delivery, it's essential to ensure that these advancements are implemented in a way that prioritizes human needs, values, and experiences. The future of healthcare AI is not about replacing human clinicians with algorithms. Rather, it's about creating a synergistic partnership between humans and machines, where AI augments and enhances the capabilities of healthcare providers, allowing them to deliver more personalized, efficient, and equitable care. This means investing in training programs that equip healthcare providers with the skills to effectively utilize AI tools while maintaining a patient-centered approach. It also means designing AI systems that are intuitive, user-friendly, and integrate seamlessly into existing clinical workflows. Ultimately, the success of AI in healthcare will depend not just on the sophistication of our algorithms, but on our ability to bridge the gap between technology and humanity, creating a healthcare system that is both technologically advanced and deeply compassionate, a system that truly sees and serves the needs of all. In the relentless pursuit of technological advancement within healthcare, it's easy to get caught up in the allure of speed, efficiency, and data-driven solutions. We envision a future where diagnoses are instantaneous, treatments are precisely targeted, and administrative burdens are lifted from the shoulders of healthcare providers. While these advancements are undoubtedly valuable, we must not lose sight of the fundamental human needs that lie at the heart of healthcare. Patients, at their core, crave more than just a swift resolution to their ailments. They long to be seen, heard, and understood as individuals. not just as a collection of symptoms or data points. This innate need for human connection transcends the realm of objective medical care. It speaks to the very essence of what it means to be cared for, to feel a sense of empathy and validation in moments of vulnerability. Beyond the desire for accurate diagnoses and effective treatments lies a deeper longing for compassion, for a healthcare experience that acknowledges the emotional and psychological toll of illness. Patients want to feel a sense of partnership with their healthcare providers, to be active participants in their own care, and to have their concerns heard and addressed with empathy and respect. As we increasingly integrate AI into healthcare systems, it's imperative to ask ourselves, are we enhancing the human experience of care or inadvertently eroding it? Are we leveraging technology to empower both patients and providers, or are we risking the creation of a system that prioritizes efficiency at the expense of empathy? Empathy, the ability to understand and share the feelings of another, is not merely a social nicety. It's a fundamental pillar of effective healthcare. Countless studies have demonstrated the profound impact of empathy on patient outcomes. When patients feel heard, understood, and respected by their healthcare providers, they are more likely to adhere to treatment plans, experience less pain and anxiety, and report higher levels of satisfaction with their care. The healing power of empathy extends beyond the patient-provider relationship. Empathy within healthcare teams fosters better communication, collaboration, and ultimately better patient care. When healthcare professionals feel supported and valued by their colleagues, they are better equipped to provide compassionate and patient-centered care. However, in an era of increasing reliance on technology, the human element of healthcare is at risk of being overshadowed. Electronic health records, while valuable for storing and sharing patient information, can also create a physical and metaphorical barrier between providers and patients, shifting the focus from face-to-face interaction to data entry and screen time. The challenge then is to find ways to leverage technology in a way that enhances rather than hinders human connection in healthcare. This requires a conscious effort to design AI systems that prioritize empathy and patient-centeredness, as well as training programs that equip healthcare providers with the skills to effectively integrate technology while preserving the human touch. As AI systems become increasingly sophisticated, capable of analyzing complex medical data and even generating human-like text and speech, we are faced with a profound question. What happens when the provider doesn't have a pulse? Can an algorithm truly replicate the empathy, intuition, and nuanced understanding of a human healthcare provider? While AI has made significant strides in mimicking certain aspects of human interaction, it's essential to acknowledge its limitations. Empathy, in its truest sense, requires more than just recognizing and responding to emotional cues. It involves a deep understanding of the human experience, the ability to step into another person's shoes and see the world through their eyes. The prospect of AI-driven healthcare raises a number of ethical and philosophical questions. Can a machine truly understand the nuances of human suffering, the fear and uncertainty that often accompany illness? Can it provide the kind of compassionate support and guidance that patients need to navigate difficult medical decisions? It's crucial that we approach the integration of AI into healthcare with a healthy dose of caution and critical thinking. While AI can be a powerful tool for improving efficiency and accuracy, it should not be seen as a replacement for human connection and empathy in healthcare. The future of healthcare is not an either-or proposition when it comes to AI and human providers. Instead, the most promising path forward lies in a hybrid approach, one that leverages the strengths of both while recognizing their inherent limitations. AI excels at tasks that require speed, precision, and the ability to process vast amounts of data. It can analyze medical images, flag potential drug interactions, and even assist with surgical procedures. Tasks that can free up human clinicians to focus on what they do best: building relationships, providing emotional support, and making complex medical decisions that require nuanced judgment and intuition. This hybrid model of care requires a fundamental shift in how we think about the roles of both humans and machines in healthcare. AI should be viewed as a powerful tool that can enhance and augment, but not replace, the expertise and compassion of human providers. The key to success lies in striking a balance, a delicate dance between technological advancement and the preservation of humanistic values. By embracing a patient-centered approach that prioritizes empathy, collaboration, and shared decision-making, we can create a future where AI and human ingenuity work in harmony to deliver truly exceptional healthcare for all. We've journeyed through the complex landscape of AI in healthcare, uncovering both its remarkable potential and its inherent limitations. We've seen how algorithms, for all their computational power, can inherit our biases, amplifying existing disparities and leaving entire communities feeling unseen and unheard. But we've also glimpsed the emergence of a new wave of innovators striving to build more inclusive, transparent, and empathetic AI systems that see beyond data points to the human beings they serve. The story of AI in healthcare is still being written, and the choices we make today will determine the kind of healthcare system we create for tomorrow. Will it be a system that prioritizes efficiency over empathy, replacing human connection with cold, calculating algorithms? Or will it be a system that harnesses the power of technology to enhance human capabilities, creating a future where AI and human ingenuity work in harmony to deliver truly exceptional care for all? The question at the heart of this technological revolution is not whether AI can replace doctors or nurses, but rather how we can ensure that AI serves its truest purpose: to improve human health and well-being. It's about recognizing that healthcare is not just about treating diseases. It's about caring for people. It's about alleviating suffering, providing comfort, and empowering individuals to live healthier, happier lives. As we move forward, we must resist the allure of technological determinism, the notion that technology alone will solve our healthcare challenges. The future of healthcare lies not in replacing human judgment with algorithms, but in finding ways to integrate AI in a way that enhances our capacity for empathy, compassion, and individualized care. Creating a future where technology truly sees us in all our diversity, complexity, and shared humanity requires a fundamental shift in perspective. It demands that we move beyond a purely data-driven approach to healthcare and embrace a more holistic understanding of health and well-being, one that acknowledges the intricate interplay of biological, social, environmental, and emotional factors that shape our lives. This means investing in the development of AI systems that are trained on inclusive and representative datasets, capturing the full spectrum of human diversity. It means designing algorithms that are transparent and accountable, allowing both patients and providers to understand how decisions are made and to identify and mitigate potential biases. But it also means recognizing that technology alone cannot solve the deep-seated inequities that plague our healthcare systems. We need to address the social determinants of health: poverty, discrimination, lack of access to education and opportunity, that continue to create barriers to care for far too many. Ultimately, the future of healthcare depends on our collective will to create a system that is as humane as it is technologically advanced, a system where every individual feels seen, heard, and valued. As we stand at the cusp of this technological revolution, let us choose to build a future where AI empowers us to be more human, more compassionate, and more dedicated to the well-being of all.